Welcome. Today's video is on the eye and the eye pinning assignment that you will have in the lab. There are about 10 different items that you need to identify. During this video, we're going to use both actual eyes that you will be using in lab as well as some models. The eye is a very delicate and somewhat small item to work with, so it will be a little bit easier for us to point out a few items on the models as well. The eyes and the models themselves are a lot like Russian nesting dolls. Every time you remove a layer, there's another item to identify underneath. So please be aware of that. As you're working with the eye, when you identify and pin the structures, you're going to be working from the outside in.
Good. So when you first get your eye, it's going to look something like this. We can see we have the eyelashes, the eyelids, we've got muscle, we've got a lot of connective tissue and fat around it. The first thing you want to do is you want to take a pair of scissors and you want to trim all of the muscle and the connective tissue off till it looks like these two that we have over here. You can see they're all clean and trimmed up. The first two things you can identify is the cornea, which is the clear part around here, and the sclera, which is the white part around the edge. So we can also see that we have the sclera around the edge here. Then also on looking at from the posterior, we can see that we have the optic nerve right here, which you will also have to pin. Once you have got your eyeball like this, you want to cut around the cornea, or just behind the cornea, so you separate the eye into an anterior section and a posterior section, and it should look something like this here. You want to be careful when you first cut into it with a scalpel, because the vitreous humor may squirt out. So once you have it cut, the next things that you can identify are the choroid tunic. The choroid tunic is this black layer around the back, and in the sheep's eye it has a slightly iridescent quality, so you could just stick your pin in the black there. Next we have the retina, which is this tissue paper like covering that's kind of all bunched up here, but it's grey or light grey and looks like tissue paper. And then we also have the vitreous humor, which is this clear liquid, and most of it has run down into the bottom of the tray down here, but we can still see we have a little bit of the clear liquid in here. So once you've cut the eyeball where all the vitreous humor runs out, just stick a pin in that. We also have, we can see that we have the lens here, so in the anterior portion of the eye you want to cut around the lens and pop the lens out and stick a pin in the lens. Next, we're going to look at the pupil, the iris, and the ciliary body. So first of all, the pupil isn't an actual structure, it's a hole. So when you look through the anterior section of the eye from the back, you're going to see a whole area where you can see light, or here we can see the blue of the dissecting tray. So that is the pupil. Then just around that is a black area, which is the iris. So you're going to pin the pupil in the clear part, and then right next to it in the black part we have the iris. And then we have the ciliary body, which is this pleated layer that runs around the outside, and you're going to stick a pin in that for the ciliary body.